Hi, my name is Sarah Lewick. The other members of the group are Kaylee Kidwell, Chantel Udall, and Bailey Neal. Our group project is to improve the low birth weight of babies in Zimbabwe through helping to educate their mothers on proper sanitation and hygiene methods. For a baby to be considered to have a low birth weight, they are born weighing less than 2,500 grams or 5.5 pounds. In Zimbabwe, 11% of infants born are considered to have a low birth weight. 33% of children under 5 are considered to be stunted, which is having a low height for the age of the child. 12% are underweight, which is having a low weight for the age of the child, and 7% are wasted, which is having a low weight for the height of the child. Low birth weight is affected greatly in Zimbabwe by the diseases caused through lack of sanitation. Up to 60% of people in Zimbabwe do not have improved bathroom facilities, and over 60% of rural areas do not have proper water supplies. 40% of rural areas still practice open defecation. There are several diseases caused by poor sanitation and hygiene methods. The food and waterborne diseases in Zimbabwe are hepatitis A, hepatitis B, and typhoid fever. The vector-borne diseases are malaria, dengue fever, yellow fever, and schistosomiasis.
Low birth weight in Zimbabwe, Africa can be prevented. We have an intervention overview that presents the possibilities that can be taken in order to prevent this low birth weight. Though it is a serious problem, these problems do not have to continue. Because low birth weight affects so many children in Zimbabwe, Africa, two simple means can be used through research and proper study of the low birth weight problems. We have come to realize that diseases and lack of sanitation are causing this low birth weight problems. Testing for these diseases and taking means to add to the sanitation will help to prevent these low birth weight problems in Zimbabwe, Africa. The diseases can be tested. The top 6 diseases found in Zimbabwe that caused the low birth weight included HIV, tuberculosis, lower respiratory tract infections, malnutrition, malaria, and diarrheal diseases. These can simply be tested through HIV tests, TB tests, point-of-care tests, BMI tests, RDT tests, blood, stool, and urine tests. All of these can be used to find the diseases. Depending on which diseases are detected, certain medications can be taken to treat the diseases. Other prevention mechanisms can be used by the mothers who are not sick with these diseases. These are the most important and are simple, inexpensive mechanisms that can be used to prevent these diseases. These include education about safety and sex, using tissues when coughing and sneezing, and throwing away trash. Other mechanisms include eating smaller meals and covering coughs. Mothers can prevent malnutrition by being self-reliant financially, growing nutritious gardens, being social, eating meals throughout the day. Prevention of malaria can be as simple as covering the skin with enough clothing. And HIV can be prevented through simple mechanisms of relaxation, including 20 minutes of reading a book. Additional means for preventing low birth weight in Zimbabwe, Africa include sanitation and clean water. Sanitation measures are simple and include education on how to wash and prepare food, teaching how to wash, and proper hygiene mechanisms. education on how to clean oneself and one's baby, learning how to defecate in a hygienic manner. The creation of outhouses and using these buildings to properly dispose of stools and waste can also help to maintain sanitation. Chlorine tablets and nylon cloths can be used to help filter and cleanse the water. Using tissues and disposing of trash properly also helps. This valid information is found on these credible websites. Thank you.
My name is Kaylee Kidwell, and I am going to describe how our intervention will solve the problem of low birth weights in Zimbabwe. Many of the diseases listed here are due to water that is contaminated with the various types of bacteria and viruses. Since water is essential to life, many have to use and drink the water even though they know it has been contaminated. We believe that by implementing parts of the Center for Disease Control's Global WASH programs, we can improve basic hygiene, sanitation, and water quality, which will reduce the prevalence of waterborne disease. In pregnancy, contracting one of these diseases can cause serious complications, including miscarriage and low birth weights. Improvements in sanitation will provide us a way to reduce the prevalence of disease, which will improve everyone's quality of life and not just pregnant mothers. When we take better care of sanitation, including how and where the people of Zimbabwe will go to the bathroom, we prevent diseases that can cause low birth weights from spreading, as well as creating a better and healthier living situation. With safer toileting facilities addressed, we would also like to focus on helping the mothers have good hygiene. This would include all the ways mothers can take care of themselves to have a healthy baby. Pregnant women need access to clean water, vitamins and minerals, and calories to sustain both themselves and the baby. Pregnant women also need to be educated on good hygiene techniques so they can help themselves lower the risk of contracting disease. This would include washing hands and food properly, using designated facilities for defecation, showering and cleaning oneself to prevent disease, and knowing other ways to prevent the contraction and spread of disease, both communicable and non-communicable. In addition to sanitation and personal hygiene, we believe education on other matters regarding food and water are just as important to the health of the mother and baby. We will look into alternative ways for mothers to cook so they do not have to put their baby at risk for being born underweight.
Hi, I'm Bailey Neal, and I'm going to be talking about the implementation process for our intervention. I first just want to start off with talking a little bit about some things my group members have already mentioned. It'll help me give you guys a better understanding about how we are going to implement it. Alright, so what my group members and I noticed in Zimbabwe is that there was a lack of sanitation. They don't necessarily have outhouses in these villages, and so that can cause a lot of problems if there's not a central location for people to use the bathroom. Because if they don't understand to use the bathroom at least 30 feet away from a water source, it can cause contamination and it can spread diseases, which can cause low birth weights. We also want to be focusing in on personal hygiene and proper food prep. And how we're going to do that is through education. So we are going to develop sanitation guidelines for them so that way they can understand and pass it on to future generations. And by doing that, hopefully it'll keep diseases down and keep birth weights up. So how are we going to implement this? Well, we are going to travel to Zimbabwe, and what we want to do is we are first going to build outhouses in a village or in several villages that we go visit. Depending on the size of the village will depend on how many outhouses we build. We will show them how to properly use an outhouse, and if it gets too full, how to dispose of the waste. And we will also be working on teaching classes to the people there. These classes are going to focus in on personal hygiene and food preparation. These classes will help increase birth weights because if they have proper hygiene use, they'll know how to take care of themselves better and be able to take care of their baby better. And with food preparation, there are some foods that pregnant women in Zimbabwe shouldn't eat because it's not prepared the right way, which can cause harm to their babies. And so we're just going to be focusing in on education because education is key into improving the well-being of places. It gives them knowledge, and then they can use that knowledge and pass it on and hopefully decrease disease rates and low birth weights there. And that's our implementation.